Good morning, class. For this discussion in week 4 of this final semester schedule class, we were asked to visit this kff.org website and browse healthcare disparity topics. And then we want to choose one and kind of go over how it impacts healthcare and methods to improve it, etc. So I chose a topic about present-day health disparities for Black people and how they are rooted in past policies. And so this is a topic I find to be, disgusting, obviously, but that just makes me want to learn more about it to try to continue to do my part in lowering that disparity. So, sadly, health disparities for Black people in the United States are deeply rooted in historical injustices. And this is according to Samantha Artiga. She's with the source on the KFF site, and these things include slavery, segregation, discriminatory policies, and ongoing systemic racism. These disparities occur across various aspects of healthcare, including access to quality healthcare services, health outcomes, and the prevalence of certain diseases. Understanding these disparities is a key to addressing them effectively. So let's talk about how it impacts healthcare. According to Felicia Collins at the Department of Health and Human Services, Black people often face barriers to accessing healthcare services, including lack of health insurance, transportation issues, and often geographic barriers. And studies have shown that Black patients receive lower quality of care compared to white patients, and this is leading to poorer health outcomes and higher mortality rates for conditions such as cardiovascular disease, cancer, and then obviously maternal health as well. Healthcare providers, unfortunately, may hold implicit biases that can affect their clinical decision making and interactions with Black patients, which continues to lead to those disparities. Some of the ways that we can look at addressing these policy interventions aimed at addressing systemic racism and improving access to healthcare, such as expanding Medicaid, increasing funding for community health centers, and also implementing anti-discrimination laws. Other things we can do: providing cultural competency training to healthcare providers, which helps them better understand and address unique experiences of Black patients. And then engaging with Black communities to understand their specific needs and problems that are involving them in the design and implementation of interventions. And then also increasing diversity among healthcare workers. And we know, we've read about this several times, how increasing diversity helps improve trust, amongst the healthcare team and reduces those implicit biases. Some of the evidence-based initiatives that we've looked up here: the Office of Minority Health leads efforts to improve the health of racial and ethnic minority populations through the development of policies and programs that aim to eliminate those disparities. And there's resources, data, and funding for opportunities and initiatives targeting minority health. The National Institute on Minority Health and Health Disparities conducts and supports research to understand and address health disparities, much in the same way the Office of Minority Health does. And they also fund research projects for identifying underlying causes of health disparities, therefore developing interventions to reduce them as well. Now, also the CDC also works to advance health equity and eliminate health disparities through research, policy development, and community-based interventions. So in conclusion, addressing health disparities for Black people requires, a holistic approach. It's multi-level, and it's got to address both systemic factors and individual level interventions. By implementing evidence-based policies and engaging with affected communities, also prioritizing equity in healthcare delivery, this can continue to give us progress in that area. So let's keep moving forward and do your part to get rid of these racial disparities in healthcare. Thank you.